All right, now that you know about the urinary system and how it's supposed to work, let's find out about what happens when it's not working correctly. Urinary system diseases. First thing we're going to talk about, feline cystitis. This is very, very common. Clinical signs that we're going to see, hematuria, there's blood in the urine. Dysuria, there's straining, stranguria is straining to urinate. Dysuria is they are urinating abnormally. Inappropriate urination means they're going in places they're not supposed to. Now, if my cat was trained to urinate in the toilet, I'm sure that that would have been much more popular with the kids who were supposed to be cleaning out the litter box. There are cats that can be trained to do this, but a lot of cats are not trained to do this. And what you'll find is that when cats get painful, they associate that pain with wherever they are and whatever they're feeling. So what they'll do is they'll feel this litter under their feet when they're urinating, and they will associate that feeling with the pain of urination, and therefore they'll find other places to urinate to see if that makes it better. So often we'll have to change whatever's in the litter box to make them feel better about going into the bathroom. They will also visit the litter box much more frequently. Um, we need to diagnose this with a complete urinalysis. Now, that was very early on when we were talking about how to do urinalysis or how to diagnose things in animals. What are the techniques that we use? You should know what makes a complete urinalysis. So, specific gravity, chemistry strips, the chemical strip, and sediment exam. Very often we will get a negative urine culture. That means that this cystitis is inflammatory and it is not due to any bacteria that we can grow out on culture. Radiographs may show us a normal bladder. It's really hard to see anything abnormal in a fluid-filled structure because the fluid and the tissue look the same. We may see some irregular mucosal lining and thickening of the bladder wall, especially if we do a contrast study on that radiograph. Treatment, no antibiotics. There, unless you find bacteria, there is no reason to use antibiotics. Antibiotics are overused way too much. We can change the diet. There's some allergies that cause inflammation throughout the body, and one of those places that is easily inflamed is the bladder. So sometimes we change the diet. Amitriptyline, it is a serotonin reuptake inhibitor, so it can help with anxiety. It actually can ease the discomfort of cystitis. Sometimes the cystitis is due to stress. We can administer propanthyline every 72 hours if we have incontinence. So if they're leaking urine, this propanthyline is a medication that will help to constrict that urinary sphincter. It is typically a self-limiting disease, so it may reoccur, it usually does, unfortunately, especially if they get stressed, if they come in contact with something that they're allergic to, it'll come and it will go. There's no definitive cure. We want to reduce the cat stress and change the diet. Often, if we can change the diet to something that, first of all, they're not allergic to, and secondly, causes them to drink more water, we can relieve some of the inflammatory properties, some of the things that we see that cause this cystitis. So if we can get them to drink more water, flush their system out a little bit more, it actually can make them feel a lot better. Canine cystitis is almost always a bacterial cystitis. We'll see increased urination, hematuria, dysuria, sometimes a cloudy, abnormally colored urine. Sometimes it smells worse. They'll be frequently licking their urethra, so around their vulva or around their penis. A diagnosis will be through a urinalysis. We're going to see increased white blood cells and bacteria present. We will want to do a urine culture and sensitivity and make sure that we're treating it appropriately. I've got this picture. This is actually not an animal with necessarily a urinary tract infection, but this shows how dogs like to mark their territory, and they like to get it up as high as possible. And this little pug, this is the best he can do in order to get his urine up, make himself look like a big dog. Now, we see an increase in urinary tract infections in the wintertime. There are a couple of reasons for this. Number one, there's snow on the ground, and so it's easier for owners to see blood in the urine. Number two, owners are not letting their animals out as often, and so they're retaining urine, which increases the chances of getting a cystitis. Treatment through prevention. We can avoid any unnecessary indwelling urinary catheters. We want to avoid trauma to the urinary tract during surgery. When we're using indwelling catheters, we want to use a closed system. A closed system is where we attach a sterile collection device, and usually it's an empty fluid bag with administration set, and that will collect the urine. That is a closed system. We want to select the least expensive, least toxic, and most effective antibiotic to start treatment. And often we need to dose every 8 hours. They're urinating frequently. They're removing this from their system. We want to treat them every 8 hours. That's hard for a lot of owners to do. That's every 3 times a day. That's very difficult for many owners. Any acute infection, so if it's, oh, this all of a sudden started, we're going to treat for 10 to 14 days. That can seem like a really long time, especially if you're giving treatment 3 times a day. If it's a chronic or relapsing infection, it may require 4 to 6 weeks of antibiotics. So we always want to base our treatment with culture and sensitivity results. If we have to make an empiric choice means we're making our best guess. The drug should attain effective concentrations within the urine and the tissue. Often we will start with ampicillin or amoxicillin. Those are the least expensive, least toxic. They can be very effective. The problem is that most of the bacteria that we encounter when we're doing cultures are Staphylococcus. And if you can remember, you'll learn this later, but Staphylococcus is not affected by ampicillin and amoxicillin. If you use something that attenuates this, like something with clavulanic acid, augmentin it's called, or Clavamox, you may have seen this before, that will get Staphylococcus. Trimethoprim sulfonamide is a sulfa drug that's attenuated. We also have cephalexin and enrofloxacin. Enrofloxacin is probably not the first choice you should make, but because we want lower cost and least toxic, so we want to go with something that's a little bit less heavy duty. For our clients, we want to let them know that a lot of uncomplicated UTIs can resolve without treatment. So if we don't treat it and it's just a minor UTI, we just give them lots of fluids, flush out their system, sometimes it'll just go away. But if we're going to give antibiotics, we have to give it correctly. So give it all of the antibiotics as prescribed until they're gone. Relapses are common, and they're common because either the animal is prone to it just because the way that they're made, if it's a female and they have an involuted urethra, and so there's bacteria trapped in that area, it's a real short jump into the bladder from there. So we want to repeat cultures as we're doing treatment, especially with chronic and more complicated UTIs, so that we can follow the progress. Feline uroliths stones and urethral plugs. So what we're seeing here is a kidney. Here is a kidney. Here and here. Okay. The right one is always, or most often, cranial to the left one. I think actually this is the other kidney here. It's hidden behind a intestine. Here are stones in the kidney. So this is a mineral deposit, and it's within the kidney, the part of the upper part of the pelvis of the kidney. And here is running along up above the colon, that is the urethra. And so there is a stone also here in the urethra. I'm sorry, the ureter. So the stone is making its way through into the bladder. We can do an ultrasound. We can see these stones in here as well. And this is a chart of looking at stones within a kidney. This was all together in one picture. So this is what you're seeing. Uroliths, remember, are made from crystals. Crystals come from minerals. Minerals precipitate when there's too many in the fluid volume, in the solution, and they can cause problems. Urethral plugs are typically made of mucus, and they usually will occur in cats and cause problems with cats because especially male cats have very small urethras. So struite, calcium oxalate, ammonium urate, cystine, mixed minerals. There are a couple of different types of uroliths. A lot of times they'll be asymptomatic. We won't see anything. Sometimes there will be blood in their urine. Maybe they're urinating in strange places. Maybe they'll have trouble urinating, or there's stranguria. They're straining to pass the urine. Often, if they're really working hard, they'll vomit. If a cat remains blocked for too long, usually that's 2 to 3 days, they will collapse and die. We cannot leave a cat blocked. They have to pass the urine. Diagnosis is through radiology or ultrasound, which can help us locate the position within the urinary tract. We can do analysis of the uroliths, so we can take uroliths out, or if they urinate them out, we can analyze them, send them away. We need to do that because sometimes these uroliths are made of mixed minerals. So that could be calcium oxalate in the center, and then have a layer of struvite, then have a layer of calcium oxalate, then a layer of struvite. And so in order to properly treat it, we need to know what it is. Small uroliths could be collected by the catheter when we're obtaining a urine sample. So we want to look at the urine sample for that. Medical treatment. So these are treated differently. Calcium we find in pH that is more acidic, and in struvite crystals we find in urine with pH that's more basic. So struvite uroliths actually can be treated by inducing their dissolution. So we can dissolve struvite uroliths with a diet that reduces urine pH. And this diet is Hill's prescription diet, Feline SD. We have to give them that and only that, and the canned variety of that diet works best, but we will see dissolution of this usually within 4 to 8 weeks. We do want to monitor that with an X-ray every 2 to 4 weeks. Antibiotics can help prevent secondary bacterial infections, but again, when you give antibiotics, they have to give them properly. Sometimes we need to do surgery to remove these uroliths. If we have a lot of uroliths, we cannot dissolve them with a diet. We can do surgery to remove all of those uroliths, and then post-surgery we can do X-rays to make sure that they're all removed. Uroliths can also be retrograded back into the bladder or removed from the urethra if we have a well-lubricated open-end feline catheter, and we insert it into the urethra and then use a big syringe with saline and propulse the urolith back into the bladder, which we may have to do if they are blocked. Then we want to monitor the animal's urine flow, make sure it's continuing to urinate. Surgery, if we have to, if they're completely blocked and there's nothing else we can do, or they continually get blocked, we can do surgery on a male cat called a perineal urethrostomy. A perineal urethrostomy is taking the penis of the cat, amputating a portion of it, pulling out to the widest part, and actually flaying it out, laying it out, opening it up, slitting it open, laying it out so that it looks like a vulva instead of a penis. And that just opens things up for them to urinate out. And we may or may not have to do a cystotomy. Otomy means make a hole in it. So doing a cystotomy means opening up the bladder and removing those uroliths. Here is a picture. This is probably a canine urolith. To be honest, that's a lot of stones. But this is one surgery with all those stones from a bladder. You can see the thickness of this bladder wall. This is a very irritated bladder. If the uroliths do not dissolve, we have to do surgery. We do want to feed them only the prescription diet. There are diets that help to prevent the formation of stones, and some animals are more prone to prevent these stones than others. Canned food provides more dietary water and gives you a more dilute diet, so it helps them to flush their system out more. Antibiotics may be needed for some of these cats. We have to see these guys. This is an absolute emergency. We need to see these guys right away. Here's a picture of the perineal urethrostomy. Here is the bladder with some stones in it. They have a prostate gland. They have a bulbourethral gland. Here's where it bends, and you can see it narrows as it leaves the body. If we have a stone there, we need to open it up to the widest point, which is here. What we do is we dissect around the penis, pull it all the way out. We slit it open and we suture it in place. Okay, so it is open all the way to this point here. And we pull it out and we flay it out like this, like a vulva. And this is what it looks like in a male cat. Urethral plugs. So usually this is with mucus, not necessarily a stone. They are straining to urinate. They're vomiting. They'll be dehydrated. They'll collapse and they'll die within 3 to 6 days. It affects their whole system because they're retaining electrolytes and toxins that they would normally remove from their body. Diagnosis is the same as with urethral obstruction. You'll have an enlarged, firm bladder. Don't press it too hard. If it's been enlarged for some time, that bladder will have weak walls and you can actually rupture it. In a chemistry, you'll see increased BUN, potassium, phosphate, and calcium. So it's increasing all of those things. It's being secreted back into the blood, or reabsorbed, I'm sorry, back into the blood. And so we have toxins in the body. Canine, they also get urolithiasis, and in my experience, it's even more frequently than we see in cats. We see dysuria and hematuria. This is a contrast cystogram. Some stones are not able to be picked up on x-ray. Most are, but there are some that don't have enough mineral in them, or don't have a mineral that is dense enough to see it. And this is a double contrast cystogram. Contrast material has been infused, urine has been removed, contrast material has been infused into the bladder through the urethra, through a catheter. And then air has been pumped in behind it so that we can see things surrounded. We can see the lining of the wall that has contrast material, and then air, and then we have more contrast material with stones here in the center. Diagnosis, we'll want to do a urinalysis. We may or may not see crystalluria. We may see crystals, but often we don't because they're all in the stones. Hematuria, increased protein and increased bacteria are common. If we can do x-rays, we can identify the location, the size, and the number. We do want to do a stone analysis once we get a stone out. That is important for treatment. Treatment must be aimed at decreasing urine saturation, increasing solubility of the crystalline material in the urine, and increasing urine volume. So we want to dilute that urine. We do that by changing the diet, and we want to promote more of an acidic urine, typically more of an acidic urine, because most of these stones are struvite. We want to induce diuresis, so we want to flood the kidney with fluid and get that fluid out of the body. And we will often need to provide antibiotics for infection. So sometimes the cause of this urolithiasis are these the precipitation of these crystals around. It has to have a nidus. It has something to grow on. Sometimes it's starting on a bacteria. So sometimes antibiotics actually starts the crystallization. Treatment, surgical or non-surgical, if we can remove the uroliths. We want to find the cause of the uroliths. If it's an infection, we want to treat that. We can insert a catheter if we want to remove small stones. If they are stuck, we can use urohydropulsion or digital pressure on the bladder of an anesthetized dog to gently propulse small stones through the bladder and through their urethra. Not going to propulse these guys. These are too big. Okay. Special diet may be needed throughout the dog's life with no table foods or treats. We know that we have too much salt in our diet. That salt can really affect their kidneys and their urine. Long-term antibiotics may be needed. Uroliths can reoccur at any time, and required follow-up labs and RADs, not REDs, RADs are needed. Okay, acute renal failure. This affects the kidney. Acute means it's happening right now, happening very quickly. What we can see is oliguria. Oliguria means we're urinating less than normal. Polyuria means we're urinating more than normal. So either one can happen. Fever, if it's an infectious acute renal failure. Kidneys are painful with palpation. And when we palpate kidneys, often we're doing it by pressing on the back muscles. Vomiting and diarrhea, anorexia, and dehydration. Diagnosis is through physical exam and a history of an ischemic episode or toxin exposure. A urinalysis will show us an active sediment, which means we have white blood cells and bacteria. We may see casts as well. Chemistry will show us an increased PCV, meaning that they have increased red blood cell count, which tells us we have some dehydration. Increased BUN, which is a toxin that's usually filtered out with the kidney. Increased creatinine, potassium, phosphorus, and acidosis. So we're not getting the things out that we're supposed to. So treatment, IV fluids, IVF, IV fluids. Isotonic saline is our first choice. Then we want to discontinue any potentially nephrotoxic drugs. So if we were giving them a medication that is damaging the kidney, obviously stop that. Metoclopramide is Reglan. Metoclopramide is a medication that we give to increase the movement of the GI tract. Cimetidine is a medication, an antihistamine that we give to decrease the pH levels of the gastrointestinal system because they tend to have ulcerations. Sucralfate is something that helps to coat the GI system. And again, if we're having anorexia or vomiting, we want to do that to help them eat again. If we have too much phosphate in blood, we can use things called phosphate binders. Every time we feed them, we give them Malox or Amphogel that pulls the phosphate out of the bloodstream before it can get to the kidney. We also want to give them diuretics. Diuretics will help to move fluids through the kidney so we can flush that kidney out. Dopamine, furosemide, and mannitol are all diuretics we can use. Client info, things you need to tell the client. You may see improvement with treatment, but they usually never get back to normal levels. We do have a guarded prognosis. It really depends on how quickly we can start treating them. There may be some underlying conditions that are responsible for this, and those may require long-term management. Diet and freshwater access from here on out are crucial. Grapes, I have these up here because they do cause acute renal failure. Other things that cause acute renal failure, toxicity-wise, would be onions and ibuprofen or high levels of Tylenol. Chronic renal failure is when this has been happening over time. You'll see a dullness, a lethargy. It progresses over time. Weakness, weight loss, anorexia, vomiting and or diarrhea. And in cats, they get constipated, which is much more common in cats than in dogs. Polyuria, polydipsia, sudden blindness. I want you to think about that for a second. We'll come back to it. Why would they get sudden blindness? And then some gait disturbances in cats. Okay, coming back to the sudden blindness. The reason is that when we have chronic renal failure, the kidney is partially in charge of blood pressure. And so if we have problems with the kidney, it's not producing antidiuretic hormone, and it is having problems maintaining blood pressure and the RAA system, which we'll get into later as well. So when it can't maintain blood pressure, the first place we see blood vessels bursting because of blood pressure is in the retina at the back of the eye. So we'll have sudden blindness. All right, so diagnosis, we're going to see acidosis. Kidneys are not helping with acid-base balance, so we'll see acidosis. We'll see anemia because the kidney is no longer producing the hormone erythropoietin to make more red blood cells. We'll see increased BUN and creatinine, hyperphosphatemia, hypercalcemia, or hypocalcemia, either one, depends on what's going on, and proteinuria. Treatment is supportive care and correcting imbalances. So if we have dehydration or electrolyte imbalances or GI symptoms, we need to correct all that and support that. Fluids, IV or sub-Q, potassium gluconate daily because they're not retaining the reabsorbing potassium. They are reabsorbing too much phosphorus typically, so we need to bind that phosphorus in the GI tract and remove it that way instead of expecting the kidney to do it. Calcium carbonate, sodium bicarbonate, cimetidine, ranitidine, sucralfate, and allopril helps to diurese the kidney, diltiazem, propranolol. These are a lot of different medications that help with chronic renal failure, but the most common thing that we do is we change the diet to something that supports the kidney. Hill's Kidney Diet, KD, Royal Canine Renal Failure Diet. We've seen incredible good stuff with those diets. We get 3 to 4 years of life with doing those diets and doing sub-Q fluids as needed. This will give us a lot of time, and then as we need to support them more and more, we'll add more and more drugs. So more treatment, diuretics, hormones, vitamin B supplements, a lot of stuff going on. Chronic renal failure is irreversible, and typically we don't see signs of chronic renal failure, including the increase in blood urea nitrogen, until one whole kidney is gone and part of another is gone. So we do want to try to find it earlier than that. There are new tests that we can see if we're starting to see a little increase in drinking. or we see severe renal or dental disease. That's one of the causes of chronic renal failure. Just bacterial infections that are constantly attacking the kidney and scarring down those nephrons and not allowing them to work. We can do early tests of the urine in order to test the protein creatinine ratio that will give us an early indication of what's going on with the kidney. So treatment is aimed at slowing the progression and relieving any clinical symptoms, so sub-Q fluids at home. At some point, we are going to need to talk about euthanasia. When is the right time? Right, urinary incontinence. The clinical signs, the owner will report that urine is leaking while they're sleeping usually or exercising. That perineal area may always be wet. We have to remember there's often a concurrent UTI disease, so we have to do a urinalysis and look for a UTI disease. It will make urinary incontinence worse, and also urinary incontinence, because that area is always open and always wet, makes UTI more common with these animals. So we'll often see it in an older spayed female dog or an uncastrated male dog. We can do x-rays and cystography. We can do a chemistry to rule out any other type of cause of polyuria from an endocrine disease or chronic renal failure. So we do need to do some diagnosis. Don't just assume they're old, they're incontinent. Treatment is based on the specific cause. A lot of times it's based on endocrine imbalance in spayed female dogs. We used to do diethylstilbestrol. We don't do that as much anymore. It's DES, and it causes some, it's an estrogen supplement. It causes some problems, not only in the dogs, but also in the people that administer it. If we have a urethral sphincter hypotonus, we use phenylpropanolamine. We also call this PPA or PPL, or you may have seen it as Proin. And we start with every 8 hours or maybe every 12 hours, and then we try to get it to the lowest level possible so that the owner may be giving it once a day or once every couple of days, just to contain that, to constrict that sphincter. And we think that this hypotonus is due to a decrease in estrogen levels in the animal. Hypercontractile bladder, so it's just constricting quite a bit. We can use propanthyline and oxybutynin. Want to tell the client that a complete physical exam and labs are required to diagnose a specific cause. They're going to tell you the dog is old and they're leaking urine. We just got to treat it. Nope, we got to figure out if there's anything else going on. We need to adjust, and we likely will adjust the medication as we go along. There may be some other health problems that complicate our medication choices. If it's due to trauma or inflammation, it may actually correct itself with time. If it's due to paralytic bladder, we may have to teach the owner to catheterize daily and manually express it to prevent overfilling. So some key terms we need you to know about here. Urinary calculi are an abnormal concretion in any part of the urinary system, kidney, urine, urinary bladder, or urethra, even the ureter. Cystitis is inflammation of the urinary bladder. Cystocentesis is the tapping of the urinary bladder with a needle to remove urine, and this may be necessary to prevent rupture of the bladder. Cystotomy is opening of the urinary bladder, typically for surgery, typically to remove something. Nephrectomy is the removal of a kidney. Nephrotomy is a surgical incision into a kidney. Pyelonephritis is inflammation of the kidney and its pelvis. And that's all I have for urinary diseases. So if you have any questions, let's bring them to class and discuss.